Hola, soy Alma y soy estudiante de medicina. Hi, my name is Alma. I'm a medical student at Tulane University School of Medicine. And one of the activities that I'm involved in is volunteering at student-run clinics.
Hi, Felipe, right? My name is Alma. I'm a first-year medical student, and I'm just going to be taking your history today.
And these clinics are pretty neat because they allow for the people in New Orleans who don't have access to care to go someplace and get care. What we do as students is we do take their history of present illness, their chief complaint, we do a limited physical exam, and kind of have practice interacting. And then we'll present to our attending physician or a fourth-year medical student. It's a really cool experience for us because we're learning, but also I think it's a wonderful way to bring healthcare to these people. So I remember even when I was sick, or my brother or sister, we didn't have a primary care physician, we didn't have a family doctor that we saw regularly. We went to the clinic. And then in my life, later on along the way, I realized that that's kind of a common issue for a lot of people. So I remember that sometimes when my dad was really sick, he would go to the emergency room. Other times, I don't really think he went in all that much. And when I was 8 years old, I didn't really know what AIDS was. I didn't know that it was this incurable disease. I didn't know that it was this really bad thing. What I did know is that my father had it, and that's what killed him. The access to medical care is really full of obstacles and barriers, not even monetary, sometimes cultural, language. So here I am in med school, and I'm teaching a medical Spanish class so that there's more doctors who speak Spanish and who can communicate with their patients and who can kind of provide that aspect of bonding with their patient, which I think is really important. Sometimes it might seem helpless. There's so many health issues. There's lack of access to education, there's socioeconomic barriers. But the way I see it is we can do something about it, and that's what I'm working towards. Another thing that I'm working on while here is my MPH, Master's in Public Health, and I really hope to use that to bring together my, I guess you could say, desire to treat the individual patient in a clinical setting and actually treat symptoms and disease and care for the patient one-on-one, with the need for something to make healthcare access better for people who don't have access to healthcare. Some educational programs, nutritional programs. I'm really interested in working with communities of underserved people. I see myself working with underserved populations and helping them achieve better health, and educating them so that they can take charge of their own health. And I'm really excited about the opportunity of possibly going on a trip with Timmy, who does a wonderful public health outreach in other countries. So even though my father passed away when I was 9, I wonder what it would be like today to have him around. I wonder how he would feel knowing that I'm going to be a doctor. My father is always going to be my motivating source to keep moving forward and make all those plans come true.